Hello and welcome to this session where I'm going to be sharing about pathology, introduction to pathology, in as far as the demystification of the things, the information that the world and the public knows about pathology. So members, ladies and gentlemen, I request each one of us to follow carefully. We listen and analyze each and every statement because there is a lot we are going to learn in this session. So at this point, allow me to start sharing my story. So this is Introduction to Pathology, and the presenter is Dr. Manira Chiza Robert, and doing M.Med, that is Masters of Medicine in Pathology, second year. You might, at Makerere University College of Health Sciences, you might ask that what is the meaning of SHO? SHO is the Senior House Officer. When you are doing any masters in any masters, which is actually typically clinical discipline, starting from general surgery, obstetrics and gynecology, ophthalmology, pediatrics, internal medicine, pathology, all those are typical clinical disciplines. Therefore, when you are doing them, you are referred to as a senior house officer. So you are a resident, you are full-time. That's why you are called a senior house officer. Intern doctors, those ones who have just completed the 5 years, and they are maybe in the 6th year. Of course, intern doctors are not students, they are qualified, they are professionals, they are professional doctors, qualified, but who are serving and working under supervision before they can be given their certificates and they be allowed to register with the relevant councils, so that professional councils and bodies, so that they can practice medicine independently. So the intern doctors are called junior house officers. Those ones who have just graduated after 5 years or 6 years of medical training, depending on the country. So they are the junior house officers. Then when you enroll for a master's after, of course, some years of practice, you are referred to as a senior house officer. So I'm in my 2nd year, and I'm here to demystify. You know, the world knows a lot of negatives about pathology as a discipline, and here I am to demystify that information, and I give you information, and we share information in this session so that you know what pathology is all about. So that from today onwards, your perception changes from negative to positive. Okay, so let me now introduce my discipline, and I begin with an overview. Let me first look for my laser pointer. Yes, let's have an overview. A quick overview. We are going to begin with the definition. We go the next. Let me turn off the video. We are going to begin with the definition. The next is a review of the basic sciences, a review of other clinical sciences and other actually other than pathology. Pathology as a discipline, branches of pathology, general pathology, systemic pathology, and the frequently asked questions. So definition, the word pathology is derived from 2 Greek words, that is pathos, referring or meaning suffering, and logos meaning to study. Like though we studied the biology from senior 1, introduction to biology, we are given the definition that biology is defined as the study of life. It comes from still two Greek words, bios, logos, or bios, logia. Logos is in Greek, then logia is in Latin, referring to all of them referring to study. So pathos, so bios, life, logos to show the study of life, biology. So here, pathos meaning suffering, and logos meaning to study. So which kind of suffering are we looking at here? We are looking at diseases, disease processes. In pathology, we study the human body from the molecular level to the cellular level, to the tissue level. That is there you are studying the disease processes from the molecular level up to the time all the tissues, organ systems, and the entire organism will be involved by the disease, or with up to the point to be affected by the disease. And you also go ahead to study how that human organism will also will recover from the disease, up to recovery or up to death, with or without treatment, like that. But of course, treatment must be there, because it is unethical not to treat a human being who is sick, or any organism that is sick. So basically, we study diseases, and not this. We don't only look at diseases of maybe of children, or of gynecology, females, or adults. No, we look at all the diseases that affect a human being, whether acquired, whether genetic. We are going to see in the next, actually in the next few slides that I'm going to share with you. So pathos, study of diseases, suffering, and logos meaning to study. It can also be defined as a scientific study of structure and function of the body in disease. We see that pathology consists of the abnormalities that occur in normal gross anatomy, embryology, histology, biochemistry, physiology, owing to disease. So this is why we're going to see. We are going to see what happens exactly, what pathology is all about in relation to gross anatomy, embryology, histology, biochemistry, physiology, owing to disease. We are going to see what happens. So another commonly used term with the reference to study of diseases is pathophysiology, which is comprised of two words. Which two words? We have patho, meaning suffering with diseases. Then pathology, physiology, study of normal function. Physiology, as we are going to see, physiology from the word physis. Then, as we continue to see, we see that pathophysiology thus includes the study of disordered, look at this word, disordered function or breakdown of homeostasis in diseases. Homeostasis, what does it mean? There must be a balance. For example, if I have too much water in my blood, it means it is going to cause. If I have too much water or component in my vasculature, in my blood, it means my plasma is going to, there will be plasma expansion, and plasma expansion is going to also cause havoc on my blood cardiovascular system. That's the heart and the blood vessels, and eventually high blood pressure or hypertension. So there must be a balance. We must have normal amounts of normal volumes of blood, plasma, or normal blood volume with of course under also a normal cardiovascular system, a normal heart, a normal vasculature, to avoid having hypertension. So there must be a balance. So that is homeostasis. So that's why we say that, for example, too much of everything is bad, or even also too little is bad, and also too much is bad. For example, if someone is having less blood, there will be problems. If someone is having too much blood that is in excess, also there will be problems altogether. So that is the meaning of homeostasis. There must be a balance. There must be, everything must be maintained in the normal values, in the normal ranges. That is all about homeostasis. So patho, we have two terminologies which are fused, I can use the genetic language of a chimera. So this is a chimeric word, or a fossil. Like, fossilization in literature and the English. When I make my own vocabulary, for example, if I combine the word capability with the ability, and I say capability, that is a fossil. I have formed a new word, new vocabulary. Capability with ability, capability. So that is a fossil, a chimera in the language of genetics. So pathophysiology, pathos, suffering, disease processes, then physiology. So how the body functions in disease. So how the body functions when it is diseased. So that is pathophysiology. Okay. Now, let us now review, let us now go to the review of the basic sciences. So I begin with the human anatomy. For us to understand, I know the world knows that the pathology is all about doing postmortems or autopsies. No, from today onwards, you are going to know that pathology is a very, very broad discipline that involves a lot of things that are actually going to surprise you in the next maybe 15 minutes. So let us begin with the review of the basic sciences. These are also called the biomedical sciences, basic sciences, or preclinical sciences. So any doctor, anyone who is going to become a medical doctor, a pharmacist, anyone who is going to become a dental surgeon, anyone who's going to become a graduate nurse, he or she must first study these disciplines. Now look here, pay attention, please. Pay attention, please. For us to understand pathology, we must first understand human anatomy. What does human anatomy mean? Anatomy. Anatomy, the word anatomy comes from Greek word. I'm sorry to be giving you this information, but it's for the good of each one of us, dear brothers and sisters who are upcoming doctors, who are upcoming nurses, who are upcoming actually general medics. We are colleagues in the profession, but I'm sorry to keep on wasting your time, but I like giving my information. Any little information that I know, be it too much, be it little, I like giving it from the first principles. It is on this background that I request you to bear with me, to tolerate me, so that I give you my information from the first principles. So, basic sciences, preclinical sciences, biomedical sciences. These are the foundational courses that we begin with. Like, for example, when you are going to start a building, to start the construction of any building, from a bungalow to a storage building, or to a multi-storage building, you have to begin with the foundation. So here we are first beginning with the foundation. The first 2 years, the first 2 to 2.5 to 3 years, depending on in the country where you are studying from, everywhere, the whole world will begin with human anatomy, biochemistry, physiology, microbiology, pharmacology, as we are going to see. So what does this mean? Why this? You might ask that now. Why is this man taking us through anatomy, through these things? Yet the focus should be pathology. Now let me begin my story about these basic sciences. Look here. Anatomy also has branches. Branches, what are these branches? We have embryology, we have histology, not histology from history. Histology, we have gross anatomy. So I begin with embryology. So, but yes, for anatomy comes from a Greek word. A Greek word which means ana, which means upon, then tomos. Ana, upon, then tomos, cutting upon. So it is where you study the structure and the architecture of the human body by cutting, by dissecting the human body. So through dissections, through cadaveric dissections, through cutting, through making incisions, hence ana upon, cutting upon. Okay, so the language of medicine, generally, the vocabulary of medicine, about 98%, about 96% of the language of medicine is derived from two languages, and many two languages, that's Latin and Greek. However, along the way, of course, however, other languages come in. Other languages come in as far as the literature of medicine is concerned. Reason being, you might ask that why Greek and Latin? Greek, yes, Greek and Latin dominate the medical literature vocabulary because the founding fathers of modern medicine, were using Latin and Greek. For example, if I begin from the founding father, from the father of medicine, that is Hippocrates. Hippocrates was using Greek and Latin. Hippocrates. When you look at the great philosophers who are also medical scientists, like Aristotle to Plato, those great philosophers who are also medical scientists at the same time, all those people were using Greek and Latin. Yes, but also other languages keep on coming in the literature of medicine. For example, if I talk about influenza virus, influenza virus is derived from an Italian word, influenza, which refers to influence. So it means influence, to influence, influenza. So when someone has contracted or has been infected with, when someone contracts the infection of influenza virus, that virus, if I remember my virology very well, and particularly microbiology as a discipline, either it belongs to the class family of orthomyxoviruses or paramyxoviruses. I remember I will go and review my virology very, very well. But either in those two families, either paramyxoviruses or orthomyxoviruses. Myxa, you hear myxa. My myxa comes from Greek word referring to mucus. Now, that virus influences the mucous membranes in the nasopharyngeal cavity, in the lower respiratory cavity. It influences the mucous membranes, particularly the goblet cells, to start producing excess mucus. Influences them to produce too much mucus, influencing them, inducing them, influencing them. Hence the name influenza. So, when you look at it, the Chinese language, there's no Chinese language anywhere there's no language called Chinese, but it's called the Mandarin. In Mandarin, yes, in Mandarin, the language that is widely spoken in China, of course, it is one of the popular languages in the whole world, one of the most popular widely spoken languages in the whole world. That's Mandarin. You will see when you look at pharmacology, and you read about certain antimalarials like artesunate, yes, the Artemisia tenuis. They have Artemisia tenuis, I think even quinine, quinidine. They are categorized together as kingahosu. Kingahosu referring to Artemisia tenuis. You see, that is the Chinese language. I mean, that is the Mandarin coming in the medical literature. You also find the other languages coming in, Germany coming in like that. From the Romantic to classical languages, all of them will be coming in. French, for example, if someone, for example, is having, if I'm describing maybe a female, the skin, if I'm describing the breast of a female, of course, in the clinical setting, like in surgery, and I said, and I started describing what I'm seeing, especially beginning from the skin of the breast. And I said that peau d'orange pattern. Peau d'orange, that is the skin of an orange. Peau d'orange, skin of an orange, it is a dangerous sign. It is a dangerous sign that, oh, this person, this woman, this lady, could be having cancer of the breast, pod orange pattern of the skin, pod orange from the skin of an orange. So you see, so let us always appreciate these languages. And not avoid questioning much, because the founding fathers were using the languages, those basic languages, Latin, Greek, like that. That's why they dominate 96% of the medical literature. So human anatomy. I begin with embryology. Embryology, what does embryology mean? Embryology refers, this is where we look at the human development. From the time of conception, from that point when the male spermatozoon, the mature male spermatozoon undergoes those series of development until it goes through capacitation and it becomes ready to fertilize a mature egg, which is called an oocyte or an ovum. Then the moment the two fuse at fertilization, we say fertilization has occurred and a zygote is formed. A zygote, as you know, dear brothers and sisters, you know, you remember this science, this embryology much better than me, because me, I studied these things many years ago. At least I can say there is a decay, but still, of course, it is not an excuse that I shouldn't use it an excuse for me not to be able to read, to revise them. But you have to appreciate that these things are many. So from that point, then you see the zygote undergoing, actually becoming a cytotrophoblast, a syncytiotrophobblast, like that, through those series of development, until all those organs from the ears, the limb buds, which form the future arms and the legs. You see the nervous system forming fully. You look at the heart, that is the cardiovascular system forming from a primitive heart, which is a tube. You look at the gastrointestinal tract forming, you know, the foregut, the midgut, the hindgut, under the influence of so many genes like PAX8, sonic hedgehog, all those coming in to influence the things to happen. You see you see endocrine organs like the thyroid migrating from the second pharyngeal pouch until by the time the fetus is fully formed in the second trimester, you find that the thyroid gland has already settled in the anterior triangles of the neck, on the slightly inferior aspect in the superior triangles of the neck. Okay, I mean the anterior triangles of the neck. You see? So that is embryology. So what is it all about? Why should we look at the human development? Embryogenesis. For example, any abnormal embryology, it becomes pathology. For example, you always hear that this baby was born with a congenital heart disease, an abnormal heart, therefore needs maybe 20 million, 10 million, 50 million for the defect to be corrected. This baby was born with no anus. The anal opening is absent, imperforate anus. This baby was born with the syringomyelia, was born with the spina bifida, was born with this baby has congenital hydrocephalus, microcephaly, anencephaly. All those are cleft lip and palate, or cleft lip alone, or cleft palate alone, or a combination of the two. So all those are congenital abnormalities, and therefore they translate to abnormal embryology. Therefore, abnormal embryology becomes pathology. And to the future pediatricians, of course, everything also begins from pathology. Okay? It begins from understanding the normal embryology from the Department of Anatomy. Then in pathology, we teach you those congenital abnormalities and how they come about in details, so that in the near you are prepared to become a future vibrant pediatric surgeon, a future pediatric neurologist like that, a future pediatric cardiologist like that. So to the pediatricians, these are doctors who specialize in managing and diagnosing and managing childhood diseases those are the pediatricians. So even gynecologists also need to understand embryology and appreciate it very, very well, because they are always the first people to welcome the newborn babies, the new lives, those little angels. They are always the first people to welcome them to this planet Earth, of course, at birth. So, and every doctor should also appreciate embryology. So you must, to be also a good pathologist, you must understand embryology, how the human body develops, so that you are able to diagnose diseases properly, and you're able to interpret what other doctors cannot interpret, okay? So abnormal embryology translates to pathology. Now histology, what does histology mean? Histology, you study the human tissues. You know from our basic biology, when cells come together, they form tissues, and when tissues come together, they form organs like the heart. The brain is also a collection of the various types of cells. Then look at the stomach. The stomach is a collection of various types of tissues, cells, then forming tissues to form that organ like that. So you study the tissues. Yes, how do you study the tissues? This anatomy is also referred to as microscopic anatomy, or microscopic anatomy as well. Because you are studying the cells, the tissues, how the cells are arranged to form tissues and the organs like that, in that order. Using this, in this case, you use an aided eye. An aided eye, which is a microscope that helps us to magnify those things that cannot be seen by the naked eyes. And therefore, we opt for the microscope, which actually is able to show us very good details about the structure of the cells and the tissues. So any abnormal tissue, be it an abscess, be it a wound that is not healing, be it any infection, viral infection, parasitic infection from the small parasites, like intestinal worms, to the smallest parasites, like the malaria parasites, Plasmodium falciparum, ovary, malaria, Noresi, all those to the fungal infections in tissues, all those abnormal, therefore to the tumors, those are abnormal swellings, abnormal growth in the normal body. All those, when we take them to study them in the presence of a disease, we call it, the discipline translates into histopathology. So this is histopathology. Histopathology. To look, you get a sample. Maybe you get a piece of, I can call it a piece of flesh from the wound that has failed to heal. You take it to the laboratory. It is prepared in various steps that are orderly. Then eventually it is processed and you put on the microscope. You examine it to see whether there is a cancer, whether it is just an ordinary abscess, whether it is a normal tissue, whether there's nothing to worry about or not. So any abnormal histology becomes histopathology. So then gross anatomy. What does gross anatomy mean? Gross anatomy is whereby you study the human body, the architecture, how the human body is constructed or built through cutting the cadavers. Of course, those are the dead bodies that are preserved for study purposes, the dead human bodies. Those are the cadavers. Through cadaveric dissections, you are able to start dissecting the body systematically from the upper limb to the lower limbs. Those are the upper arm, that's the arm, to the legs. Those are the upper limb, lower limb. Anatomy. You go to the trunk, that is the chest, the abdomen, thorax, chest, or the thorax, abdomen, the pelvic cavity, that is the trunk. While cutting grossly, you are exposing things systematically in an orderly fashion, in an orderly pattern. You are not mutilating, no. You are dissecting in an orderly pattern under guidance. You keep on looking at the blood vessels, how they are made up, how they branch, how they form anastomosis. Those are the branches. you look at the nerves, you look at the muscles, you look at the bones, grossly, with the naked eye, gross, with the naked eye, what the naked eye is able to see, while cutting the body to appreciate the normal. I mean to appreciate how the normal body is built. For example, if I sustain a fracture or there's a breakage in the bone, in one of my bones, that is a fracture. So that it becomes disordered or diseased gross anatomy. Morphology, my normal morphology is disordered because there's a fracture already in the bone. If something injures my muscles or pierces me, it means my anatomy is already abnormal. So it is morbid anatomy. Disease, it becomes eventually, immediately, it becomes diseased anatomy. When there's a fracture, when something cuts me and I start bleeding, yes, even if I don't bleed, when something is hurting me, causing pressure effect on my throat, on my abdomen, any abnormal swelling, that becomes diseased anatomy, gross anatomy, diseased gross anatomy, morbid anatomy, therefore pathology. I hope we are together. So you must first know the normal things before you start going to understanding the abnormal things, okay, which is pathology. Therefore, in summary, a pathology anatomy, when anatomy goes wrong, it translates into anatomical pathology or anatomic pathology or diseased anatomy, morbid anatomy, okay? Therefore, anything here, that's why, for example, when someone has a swelling or any wound that has failed to heal or that is suspicious, a doctor will quickly, after assessing, will quickly prepare this patient and tell him or her that, you know what, this wound, I cannot keep on treating you because there's no response, you are not getting good results, and so far it is 10 months. It is 5 months, 6 months ever since I started treating you, my dear patient. Now, I'm going to take off a sample, to take off a piece of flesh, and I take it and I send it to the pathologists, who will also tell us what it is, who will also tell us what this thing is. If it is a cancer, I pray that it does not actually turn out to be a cancer. I pray for the good news. But let me prepare you, let me take you to the theater, major theater or minor theater, and I get off a piece, and I take off the specimen, the tissue, and I send it to the pathologist, and they tell us what is. Therefore, as a pathologist or as a pathologist in the making, there's no excuse. You must understand the diseases of children, diseases, gynecological and obstetric diseases. You must understand the neurological diseases. You must know diseases from orthopedic surgery, neurosurgery, cardiothoracic surgery. You are all over. You must in summary, you must understand the normal human body with all the diseases that attack that body that you know, that we are now looking at. So that is a pathologist. Now to biochemistry. Excuse me. Biochemistry, what is biochemistry all about? Biochemistry, this is whereby you look at the human body from the molecular level and how those biochemical processes are able to function in the human body, and to ensure that the physiological functions are at par. They are functioning very, very well, so that the person is able to live, so that the person is able to survive in good health and in a good body. That is biochemistry. When I talk about biochemistry, what am I looking at? Biochemistry, we study amino acids. We study amino acids to the polypeptides, to the proteins. You know, proteins are bodybuilding foods. We get them, yes, proteins are bodybuilding foods. They're also important in formation of enzymes, neurotransmitters, like that. They are also transport proteins that transport various molecules from one part of the body to the other in blood, like hormones. And of course, not all hormones are proteins in nature. We have glycoproteins, we have lipid hormones like that, or steroid hormones like that. But the proteins function for participating in building the body, the formation of those small molecules, transport molecules, then hormones, enzymes in the body like that. So you might say that, oh my God, why is this why is this doctor giving us biochemistry? The biochemistry is not important. So abnormal biochemistry going wrong, it becomes pathology. It translates into clinical or chemical pathology. That is abnormal biochemistry, okay? So let me tell you how biochemistry is important. My dear brothers and sisters, they started teaching us medicine indirectly way back in primary 4. According to Uganda's curriculum, primary school science, primary 4, it's when we start studying digestion, skeleton, we look at respiratory system is covered in primary 5, I remember. Nervous system is in P6 and P7, if I remember. But remember, in primary 4, we are taught digestion. That is the first time I came to learn about pepsin, to hear about pepsin enzyme. Then digestion, enzyme, pepsin enzyme. The definition of an enzyme in primary school, primary 4 science, I remember very, very well. Then in senior 2 biology, we again looked at digestion. Senior 2, some secondary schools also, they cover that in senior 3. But for us, at my Kabindi, at my school, O-level school, Kabindi Senior Secondary School, we studied that in senior 2. In senior 5 again, go to A-level, senior 5. Again, senior 5, we studied digestion. Can you imagine in biology? We looked at chemicals of life. Then in medical school, we looked at again digestion. I mean, we looked at the physiology of digestion. We looked at the enzymes. We looked in biochemistry. We looked at those enzymes, structure, enzymology. We looked at the cofactors. We looked at the coenzymes. Those looking at those vitamins and those. I'm forgetting those ions, the metal ions. We call them what? We call them trace elements. Yes, under trace elements which act as cofactors: iron, selenium, zinc, magnesium, like that. So again, why is it that these things keep on throwing us? Enzymes in primary 4, enzymes in primary 4, enzymes in senior 2 biology, enzymes in A-level biology, chemicals of life, enzymes in biochemistry. Why? You need to ask yourself. So why is it that enzymes are important? You see, in senior 2 biology, we started looking at the optimum pH, optimum temperatures. Okay? Now, well, for example, when someone is suffering from any disease that causes high-grade fever, like starting from the commonest malaria, before you prescribe any antimalarial, you must first lower that high-grade fever, which is maybe in 39.2 degrees Celsius, back to normal towards you lower it towards the 36 point something. Because what does that temperature mean? By the way, the normal body temperature is 36.9 degrees Celsius, but you round off to 37 degrees. So it means that 37 degrees, at that temperature, it means all the billions and billions of enzymes that we have in our bodies that carry out various metabolic functions to maintain life, it means they are able to work effectively at that temperature. That is the optimum temperature for all the billions of enzymes that function in our bodies. Okay? So it means when you maintain that fever, you start giving antimalarials to someone with a high temperature of 39 degrees Celsius, 40 degrees Celsius, you start giving your antimalarials, the person is going to die because the drugs, yes, those antimalarials are going to work, they will kill the parasites, but the temperature, it means that temperature is unfavorable. That temperature is going to start inactivating all the billions of enzymes that you have that catalyze various metabolic functions, and eventually the metabolic functions will shut down and the person will die. Therefore, you must first take back that temperature back to normal. That's why we prescribe antipyretics. We first lower the fever, this fever is extremely rare. There's hyperpyrexia. Okay, there's high-grade fever. Let us you first work on this fever. You roll it, okay? Now you can see the importance of biochemistry. Indirectly, we are teaching you biochemistry. They were teaching us biochemistry and therefore about the human body from primary 4. Then look at diabetic ketoacidosis of type 1. Of course, that is that presentation is in the diabetes, is a characteristic of diabetes mellitus type 1. Diabetic ketoacidosis. You know, we have the ketone bodies. When there's excessive metabolism of fats, we end up with the excessive production of ketone bodies, and the ketone bodies are going to do what? Ketone bodies are going to shift the normal blood pH from 7.4 or 7.35 towards the acidity, shifting it to 7.1 something to 6.9 something. That is dangerous for the normal for blood pH, for the enzymes to function, for the billions of the enzymes that you have in our bodies. It means that when a patient is diabetic ketoacidosis, when there are too much ketone bodies in saturation, acetoacetate, acetone, beta hydroxide butyrate, we are going to end up with of course, almost acidic pH, the way we have acidosis, and eventually the enzymes, the billions of enzymes that you have are going to start shutting down, and eventually the metabolic processes that sustain life are going to shut down. If they are not corrected and restored back to normal homeostasis, the death will follow, okay? So biochemistry. So abnormal biochemistry, it will translate to pathology, clinical pathology or chemical pathology. When urea is retained, too much urea is retained, too much sodium is retained in the blood, too much gases are being retained in the blood, that is abnormal biochemistry. How to get too much creatinine is retained in the blood, causing uremia, azotemia, what, we are going to end up with pathology, abnormal biochemistry, which is clinical pathology, which is chemical pathology. Physiology now. Physiology, what do we study in physiology? Physiology, we look at how the normal body functions, how the body's organs and organ systems function together to maintain life, how they function in harmony to maintain life. For example, when the cardiovascular system is diseased, it means the whole body will be disorganized, even other systems will be disorganized. When the digestive system is diseased, and even you know that the liver is also part, is an accessory organ of the digestive system. When the liver is diseased, maybe in liver cirrhosis, maybe in hepatocellular carcinoma, we are going to end up with the problems. The whole body will be affected. In liver cirrhosis, there will be gynecomastia. There will be testicular atrophy in males. There will be breeding tendencies. All those things. You see breeding tendencies because just one organ is diseased. Therefore, physiology, you studied the normal, how the body organs and the organ systems function together in harmony to sustain and maintain life, to maintain a good body, a normal body. For example, if a person is injured and the blood vessels are cut and that person is bleeding profusely, bleeding excessively, excessive hemorrhage, eventually there will be the plasma volume will shrink, and eventually there will be high blood pressure will fall. Then what will follow when blood pressure falls below the normal values? We shall end up in shock. And shock is very dangerous. Okay, so to prevent that, it means the body physiology has been deranged, has been disordered already. So physiology, it comes from also the Greek word physis. Then logia, logos, to study. Then physio, physis. Don't confuse it with the physics that we study. You know the physics that we study in secondary school, even and also at the university. That physics is different. The physics that we all know is the study of we look at it. It's all about we study nature, we study matter in relation to energy. That is physics. Physics, we study nature looking at matter in relation to energy, interaction of energies, and the fundamental forces, of course, that's where the fundamental forces that govern the universe come in. Gravity, is gravity a force anyway? Electromagnetism, electricity, magnetism, stronger nuclear forces, weak nuclear. Matter, we look at matter in relation to energy, that is physics. Then physiology now. Physiology is also almost the same. Physics, we are looking at nature. The nature, of course, the nature of interaction of body systems and organs to maintain life. That is physiology. So when someone has lost too much blood, that is shock. When someone, of course, is over-breathing, rapid breathing, which is tachypnea, there will be problems if someone is panting excessively, which is it is abnormal. There will be, of course, there will be we can end up with acid-base imbalance when someone is tachypneic and is not controlled. When someone is retaining urine, too much water in the body, there will be also abnormal physiology, of course, being disordered. Therefore, translating to also pathology, pathophysiology, pathology. So microbiology. Microbiology, we look at all the microorganisms. We look at the microorganisms and how they cause the diseases in our bodies. That is microbiology. What are those microorganisms? We look at the bacteria, how the bacteria invades the body and is able to cause disease in the body. We look at viruses, how viruses are able to invade our bodies and cause us diseases. We look at the parasites, from the smallest microscopic parasites to the large parasites. From the microscopic ones like malaria parasites, those are microscopic. Then to the larger parasites like intestinal worms, like the filariasis, those ones which cause filariasis or elephantiasis, the Wuchereria bancrofti. I mean those ones, the microfilaria. But when you look at the intestinal worms, like the Ascaris lumbricoids, those are large parasites. We see them with the naked eyes. We don't need the microscopes. So when you look at the fungi that cause fungal diseases, the common one, which I can say the one you call ringworms, all those are fungal infections. To cryptococcal meningitis, to cryptococcal to histoplasma capsulatum, all those are to aspergillosis. All those are fungal infections. So that we cover all that under microbiology. What they do, the damage they cause on our bodies to lead us to diseases. That is microbiology. We also look at the autoimmune diseases, we also look at immunology in a special way under microbiology. We also look at other special proteins like prions, for example, how they cause diseases like mad cow disease or bovine spongiform encephalopathy, diseases like Kuru, diseases like Creutzfeldt-Jacobs disease, CJD. All those are prion diseases. We also look at the prions in microbiology. So microbiology is also a branch of pathology. Microbiology is an independent discipline in a special way. It is also broad, but it is also a branch of pathology. Now to pharmacology. Yes, pharmacology also we also look at the drugs in relation to pathology. Okay. So when you talk microbiology, you are talking pathology. Then pharmacology, also drugs. We need to look at the drugs that we use to treat diseases. Much as we use them to treat diseases, but at the same time, they also cause diseases when they are wrongly used, when there's a mistake, when there's an error in the prescription, or when there's an intention, or when there's maybe suicide, an intent to commit suicide. All those, that's where teratogenicity comes in, toxicology comes in. So all these, still pharmacology itself leads us to pathology. So what does teratogenicity mean? For example, if I prescribe certain medications that are contraindicated in early pregnancy, and that mother at the end of 9 months, at the end of the 9 months or 3 trimesters of pregnancy, and that mother happens to give birth to a baby with congenital malformations or with abnormal heart, abnormal intestines, like intestinal atresia, or tracheoesophageal fistula, or stenosis like that, esophageal stenosis like that. And we end up with for example, because as a practicing doctor, I made a mistake. I prescribed certain medications which are contraindicated in pregnancy to a certain mother who is carrying a pregnancy of maybe that is only 6 weeks or 5 weeks. with unknowingly. And I also, as a doctor, and I don't also ask such a mother, young mother, or the mother that, you know, could you be pregnant? When did you last experience your menses? And I don't ask such questions to establish whether she could be pregnant. And I simply prescribe when the pregnancy is younger, less than 3 months, and such a mother gives birth to a child at the end of the 3 trimesters, which are 9 months, and that mother produces a baby, gives birth to a baby with abnormalities in the intestines, on the heart, or any other part of the body. It means I will have caused the iatrogenic induced, I will be the root cause of teratogenicity. It means the drugs that I prescribed cause the teratogenic effects on that innocent little human being. Okay, that is teratogenicity. So drugs, some certain drugs can cause teratogenic effects. Then also drugs also act as poisons. For example, in pharmacology, there are drugs which have very, very narrow therapeutic windows, like digoxin. When the dose of digoxin is extremely very, very low. So, for example, if you give like a dose of digoxin and you make it 0.5 milligrams, you are going to kill. You are going to kill. So it is very, very low. So meaning that it has a very, very narrow therapeutic window. So it will cause toxicity. Just any increase in dosage toxicity. Panadol. If I prescribe Panadol, maybe instead of giving 2 tablets, and I give 5 tablets, 10 tablets, that is, I'm going to cause to induce toxicology, beginning from the liver, from the hepatocytes. You see? Toxicology. So drugs, I'm also trying to show you that drugs also cause toxicities and induce various diseases to us, much as they're important, but they also induce various diseases which translate into various pathologies. Are we together? For example, if someone is suffering from alcoholic intoxication, alcoholic paracetamol poisoning, as a pathologist in the making, I should be knowing how the damage is coming about and how to reverse it. And in any case where my colleagues are actually confused, or where they have not yet figured out how to reverse it, I can also, if I'm consulted or contacted a bit early, I can also share my knowledge, and we see how we can reverse actually the toxicity as long as it is still early. You see? So this is what pathology is all about indirectly. So anything going wrong here in these basics, these are all normal things, but anything going wrong here, it translates into pathology, okay? So to be a pathologist, we must have also appreciated all these other disciplines. Now, the normal things first, then to the abnormal. So review of other clinical sciences other than pathology. So we have general surgery, obstetrics, and gynecology. You are going to know why these ones are in black and these ones are in blue. Then you have internal medicine, and then pediatrics and child health. These other disciplines, these ones that you are seeing, these together, grouped together, are called surgical disciplines. They belong to surgical disciplines. Then these two, internal medicine, pediatrics, and child health, these are called, collectively referred to as medical disciplines. So all these disciplines that you see, they are all of course made up of pathology, because you are treating diseases surgically by invading the body, but you also use medicines. By cutting, you also use medicines. So this is surgery. You are cutting the body, invading the body. But you must have understood also pathology to be a good surgeon. To make a good obstetrician and gynecologist, you must also have understood pathology. But yeah, they are also surgeons. A gynecologist is a surgeon from today onwards. Know it. They're also surgeons. Then these ones are physicians of internal medicine, physicians of pediatrics and child health, you can see. So these two surgical disciplines, these others also, these two medical disciplines. They're all made up of pathology because anywhere you are managing diseases. So diseases which you first understood by knowing pathology. Are we together? So a pathologist is a doctor as a doctor. You go to internet and Google. It's not pride. It's not about pride or just having inflated egos. This is the fact. You can go to Google and you find out why a pathologist is referred to as doctor as a doctor, doctor as a consultant, doctor as a doctor. It's not about pride, no. This in here at this point, I'm not teaching you about having inflated egos. It's not about pride. It's not about showbiz or showing off. It's about understanding our disciplines in details, and so that we in the near future we're able to make choices, informed choices like that. All these disciplines that you see are special in their own way. Now, that is the basis of having a degree of a double degree course, Bachelor of Medicine and Bachelor of Surgery. MBCHB degree, it's a double degree course, Bachelor of Medicine and hence Bachelor of Surgery. So the other basic sciences that I've been taking you through, they are the ones which make up all these other disciplines that we are seeing, all these others that we are yet to see and we are seeing at this point. Okay. Now, why these 4 disciplines? Even in internship, we find the surgical ward, find the gyne and obstetrics ward, you find internal medicine ward with various subspecialties like that. You find the pediatrics ward with various units and subspecialties like that. Even in surgery, you find the urology side, you find the plastic surgery unit, you find neurosurgery unit like that. But the whole of it is general. We have general surgery. A general surgeon, it means should have information, we should have actually some expertise on neurosurgery, orthopedics, plastic, the gastrointestinal surgery, everything, general surgery. Then they will also have subspecialties or super specializations, okay? Hence, Bachelor of Medicine and Bachelor of Surgery degree, MBCHB degree, Bachelor of Medicine and Bachelor of Surgery, MBCHB, Medicina Baccalaureus et Chirurgia Baccalaureus, because medicine language, I said, is derived from Latin and Greek. So that's why MBCHB is a Latin, it comes from Latin, Medicina Baccalaureus et Chirurgia Baccalaureus, but double degree course, Bachelor of Medicine and Bachelor of Surgery. You said, yes? Yes, those noble courses, like even Raw has, when you go to Raw school, for example, and you ask those our brothers and sisters who are studying Raw at Raw school across on the hill, and you ask them that, my brother, which course are you doing? I'm doing AeroB. AeroB. What you ask him, what is AeroB in full? Don't you know? It means Bachelor of Rigorous. Why is the entity B Aero but AeroB? The Bachelor of Rigorous. No, me, I know it is Bachelor of Rigorous anyway. Do you know the way they talk? I'm a lawyer to be, I'm a counsel to be, Bachelor of Rigorous, I'm doing Bachelor of Rigorous. No, why is the entity B but AeroB? AeroB also comes from Latin. It stands for Legnum Lata Baccalaureus. AeroB, Bachelor of Rigorous in English. Legnum Lata Baccalaureus. AeroB. So now to these other disciplines. Why these ones? These ones that are in black as well. Look here. These ones, I said, these 2 surgicals, the big ones, they're in black. Then these ones are also in black. So it means anesthesiology. This is the discipline where we studied the science of anesthetizing, rendering a patient or a person insensitive to pain so that a surgical operation can go on successfully. When the patient is not in pain, is comfortable. That is anesthesiology. So anesthesiology is a surgical discipline. Okay? So an anesthesiologist is a surgeon from today onwards. Ophthalmology, this is the discipline where we study the diagnosis and management of all the diseases that affect the eye and the surrounding anatomical structures. That is ophthalmology. So from today onwards, you should know that an ophthalmologist is a surgeon. So ophthalmology is a surgical discipline, okay? It's not a medical discipline. Then we have ear, nose, and throat surgery as a discipline, or otorhinolaryngology. Otorhinolaryngology is also a surgical. ENT surgeons or specialists are surgeons. So this is ENT is a surgical discipline, much as it is also an independent discipline, but it is a surgical discipline. Then orthopedic surgery, these are the people who work on our bones. They put in, when you have problems with the bones and muscles, they are the people who help us to correct it. These are the specialists who help us to correct those problems. They are the orthopedic surgeons. So orthopedic surgery, if it is a general, it is also a branch of or a discipline that is derived from general surgery. Then you hear urogynecologists. Those are the ones, the fetal-maternal medicine specialists. You cannot be a fetal-maternal medicine specialist when you did not do, or when you are not a gynecologist first. No, it's like, yes, it's like some of us who are Christians, me, I'm a Christian Catholic. You cannot become a bishop, for God's sake, when you are not a priest, when you are not a reverend father first. No. And neither can you become a priest, a Catholic priest, when you have when you are not a seminarian, when you have never been a seminarian, a minor seminarian. Minor seminarian, or you might go to an ordinary secondary school or a secular secondary school, but eventually become a major seminarian. But you have to first become a minor seminarian. I mean, a major seminarian, mandatory. Yes. Please, no, excuse me. So you have to first become a minor, a major seminarian. A major seminarian also begins from philosophy. You transit to pastoral work, then to theology. In theology, you become a rector, an anchorite, then from there to a deacon, a reverend deacon, then to eventually ordained to a reverend father. Then from a reverend father, we get bishops. So you cannot say that I'm going to become a fetal-maternal medicine specialist, like those ones who specialize in vitro fertilization. When you have the rule is you first become a medical doctor, then you specialize in obstetrics and gynecology, then you opt for a super specialty, which is also called a fellowship in fetal-maternal medicine, okay, or urogynecology, like that. So there's order everywhere. So look here. So a neurosurgeon, neurosurgery, cardiothoracic surgery, plastic surgery, all these branches, they are part of general surgery. Yes, there are countries and universities where these specialties from a medical officer, you enroll directly for neurosurgery. But still, the years are many. It doesn't mean that you're not going to start looking at the brain and the spinal cord and the nerves, minus studying general surgery. So everything, the mother of all the foundation is general surgery. Hence, Bachelor of Medicine and Bachelor of Surgery degree, double degree course. You have seen that all these other disciplines are made up, these are the building blocks. So the first 2 years when they are teaching us, the first 2 to 3 years when they are teaching us these things, the basic sciences, they are giving us the building blocks. They are giving us sand. They are giving us the foundation. They are giving us gravel, stones, bricks, blocks, iron bars, so that we can understand these disciplines from the 3rd year, 4th year, 5th year, even the 6th year of medicine and surgery, depending on the country where you're training from or the system where you're training from. Okay? Or then dental surgery like that. The dental surgeon, a pharmacist, they must also appreciate those other basic sciences. Of course, not these ones. But for doctors, medical doctors to be, these are mandatory. You have to know them, to rotate there and appreciate them. Because you not say that me, you cannot become a specialist in medical school that I'm going to only love pediatrics and that's what I will do. You must first study everything to all these disciplines in the first 5 years. Then eventually you fall in love with something out of all these and you go for it. Then you have now to the Bruins. Good. To the Bruins. Now to the brew, I have finished the black ones. All these are surgical disciplines. To the Bruins. Now, this psychiatry, this is where I look at mental illnesses, normal health. Of course, we first studied in the lower classes, year 2, year 1, no, year 2, I think year 2 medicine and surgery, you study psychology. Then in the third year, normal mind, from psyche, the mind. So psychiatry, you are studying the normal, it begins with psychology. Psych, the mind, then Logos to study the mind. So you begin by appreciating the normal mind, the normal behavior of a human being. Then you go to the abnormal behavior. In the third year, fourth year, you find yourself studying abnormal psychology, which is psychiatry, the normal mind. Okay? The abnormal mind, rather, psychiatry. So psychiatry, where we study mental illnesses, that this patient is mad. That is your study. It means those are mental illnesses. You are looking at abnormal mind, psychiatry. So psychiatry is a branch of, it's a medical discipline. Dermatology, even people are studying internal medicine also rotating in psychiatry as well. So dermatology, we are looking at the skin disorders. This is dermatology is, you are looking at skin disorders or skin diseases. It is a medical discipline. Cardiology. Now, look here, ladies and gentlemen. There is a difference between a cardiologist and a cardiothoracic surgeon. A neurologist from a neurosurgeon. Now look here. For me, if I want to become, for example, a cardiologist, it means I will take medicine inside. A cardiologist will study either internal medicine for a minimum of 3 years, or pediatrics and child health, which are medical discipline, which is also a medical discipline, for a minimum of 3 years while specializing. Then afterwards, I will choose to become either a cardiologist of the adult human beings. This is why we study heart disease in adults, HIV in adults, that's internal medicine. Diabetes in adults, malaria in adults, that anything, any disease in adults falls under internal medicine. Then the same malaria, the same HIV, the same same disease in children, it is in pediatrics and child health. Now, if I study internal medicine and later on I go for a fellowship in cardiology, it means I'll be treating diseases that affect the heart and the blood vessels without invading the body, using the medicines and the other investigations, but without invading the body primarily. That is, it means that is, I'm a cardiologist. If I go for such a fellowship that will take me 2 to 3 years as well, it means I will be called a cardiologist of the adults. Are we together? Then if I enroll for the same disease of children, under the same fellowship of cardiology, it means I'll be called a pediatric cardiologist. So a cardiologist. So you cannot say that as a surgeon, I'm going to do cardio. Yes, you can do it. Yes, you can still do it. Okay? So, but you must have first become one of these to become a cardiologist. Then to become a cardiothoracic surgeon, the one who operates, who treats heart diseases by invading the body, opening the chest and reaches the heart by cutting, that is invasive. That is, he or she must first become a general surgeon, then later on enrolls for a fellowship in cardiothoracic surgery to become a cardiothoracic surgeon. Therefore, let us not confuse the two. There's a difference between a cardiologist and a cardiothoracic surgeon. Then the same applies to neurology. A neurologist must first become either a physician of internal medicine or a physician of pediatrics, and then enrolls for a fellowship in neurology, brain diseases like that. Then a neurosurgeon, if the right channel is for you to first become a general surgeon, or if there's an opportunity, you go direct and you become a neurosurgeon, okay? Yes, endocrinology, gastroenterology, endocrinology, this is hormonal diseases like diabetes mellitus, Cushing's syndrome, thyroid diseases, that's endocrinology. Gastroenterology, diseases that affect the gastrointestinal system, from the mouth, the esophagus, the stomach, intestines, that is gastroenterology. Liver, pancreas, that is gastroenterology. Nephrology, looking at kidney disorders. Neonatology, looking at the disease of the newborn babies that are less than 28 days of life. Those are neonates. Then above their infants, we start talking, the language starts changing. This is an infant, not a neonate. A newborn baby, the neonatology. So to become a neonatologist, you must first become a pediatrician before you enroll for a fellowship in neonatology. Gerontology. Gerontology, here you must also first become a family medicine physician or internal medicine physician, and you specialize in diseases of the elderly. Gerontology, disease of the elderly. But primarily, you must first become a physician of internal medicine, of adults. Then you super specialize in gerontology, disease of the elderly, of already age. Then you have family medicine and community practice. Here you study some pediatrics, some gynecology, some surgery, some internal medicine. So generally, family medicine in the three, it is not a popular discipline in Uganda, but in general in East Africa, but is becoming popular. Is also another good specialty to do. So you study some general surgery, some obstetrics and gynecology, internal medicine, you study pediatrics and child health like that. That is family medicine and the community practice. These are called general practitioners in developed countries. They are the real general practitioners, not medical officers, but they are the real general practitioners or the community practice. So it doesn't mean, yes, this internal medicine, this is family medicine, as you can see, a family. So meaning, look, in general surgery, you are treating the human body, either adult or child, through cutting, invading the body. This is a family, you see. Obstetrics and gynecology, women and their reproductive system. In the presence or absence of pregnancy. You see, obstetrics and gynecology, women. Then internal medicine, adults in relation to those diseases that I mentioned, then children. So a family. Family, here you are rotating, even including the elderly, what? Even the elderly among the adults. So here you see family medicine and community practice. Okay? So to understand all these disciplines, you must have, because everywhere, what you are seeing everywhere, in all these disciplines that I have already highlighted about, you are looking at diseases and how you are diagnosing diseases and treating them or managing them in general. So it means you are looking at pathology indirectly. You must have understood the pathology. If it is a cardiologist must have understood from the primary principles of pathology from the roots that, so if I'm dealing with the tetralogy of Fallot, patent ductus arteriosus, how did it come about? From pathology, of course. If it is an abnormal tumor, maybe it is Williams tumor, it is a neuroblastoma. How did it come about? You're a pediatric surgeon, you are a pediatric oncologist. How did this neuroblastoma come about? You are able to understand it from pathology. So everything is all about diseases. Therefore, you must know, and anything, of course, for us as in pathology, they send anything from gerontology, from neonatology, nephrology. If they find an abnormal thing from the nephrology unit, send to pathology and they tell us what is. Gastroenterology unit, send it to pathology, they tell us what is. Then when they get in orthopedic surgery, send it to pathology, they tell us what it is. Ophthalmology, send this thing that we have discovered found in this person's eye to pathology team. So that they tell us what it is. Plastic surgery, we found this thing in the skin. We don't know what it is. Send to pathology. Neurosurgery, send to pathology. Pediatrics, send to pathology. Everywhere, send to pathology. So we are the people to interpret. For us, in other words, we are like the chefs. We are like the chefs. Actually, the whole world, whenever we go to restaurants and the hotels, after enjoying delicious meals, at the end of it all, we shall appreciate the waiters. Am I wrong? That I'm very right. We appreciate the waiters. Waiter, the food has been delicious. I'm very, very grateful for your services. I'll be coming back next time. I'll even come as a big team. We shall come as a big team. You have nice food, delicious food. But in reality, we're supposed to be appreciated. It is a chef who prepared the food. So a pathologist is ever in the background, but he also does the magic behind the curtains. Okay? Yes. So that's why I say that each and every specialty, each and every discipline is very, very paramount and special in its own way. Okay. Now, pathology as a discipline. Dear brothers and sisters, I'm sorry for boring you for this long, but it is for the sake of understanding this mighty discipline that is feared by the majority. It is feared and also hated, I can tell you. But at the end of this session, you will no longer be hating pathology. I know some of you are going to fall in love with pathology and you'll be following our footsteps. And we shall welcome you in the near future as you have made a decision. So pathology as a discipline, it is a clinical discipline with many areas of super specialization in the form of fellowships. Those are professional degrees. Note that a PhD is an academic degree. A PhD, you are in an academic setting, you are a big gun. But a fellowship is more of like also a PhD. But for it, it is professional, it is hands-on experience. For example, if I'm a general surgeon and I say that I'm going to become a plastic surgeon, it means I will have to enroll for a fellowship. A fellowship, which is also a professional degree, it doesn't mean that I'll stop doing other operations on the legs, or it doesn't mean that I can stop doing, as a surgeon, I can stop doing explorative laparotomy, opening the abdomen to find where the problem is and correcting it. No. If I enroll for plastic surgery as a surgeon, it doesn't mean that I'm going to throw out all the other surgeries and the skills that I have. No. It means my area of interest, like my area of interest is further and further actually inclined onto the diseases of the skin, big scars, how to correct the big scars. If someone has had burns, how to give that person a new skin of course, by doing isografting, transferring, doing skin grafting like that. Removing those bad scars. Someone who attempted to pierce the ears and developed those other keloids, on the earlobe, or is it on the tragus or the antitragus? I think it's on the tragus. Then those things that develop there, those things, that is plastic surgery. So fellowship. So it means it is a professional degree. We are going to keep on hands-on, as well as also doing researches like that. So it is more of hands-on degree. You are not entirely in class that you are doing things entirely in class. You actually, when you are doing a fellowship, you are in a certain subspecialty for a certain for a certain period, under tight supervision and guidance by those professors and seniors, the senior consultants. Then after when your period is done, they give you the exams, and when you pass them, they give you a paper that, you know what, from today onwards, this person, this surgeon is now super specialized in plastic surgery. Okay, that's the fellowship. Okay. Then a PhD, it is an academic degree. So, for example, someone with a fellowship can become a professor with the fellowships and has been doing researches and publications, can become a professor. Then the same applies to this one. Also, this is also another way. Someone with a PhD with the postdoctoral researches, publications, with the experience, then qualifies and is promoted the rank of professorship from associate professor, like that. So, ladies and gentlemen, now let me take you to the branches of pathology. Branches of pathology. I know the whole world, 99% of the whole world knows pathology as a discipline that is all about doing postmortems. Oh my God. Now this is where everything is going to be demystified from. Look here. We have anatomical pathology. When I was looking at the morbid anatomy, I had mentioned looking at the body as a whole, disease the body. That is anatomical pathology. Look at disease the organs, disease the what? Muscles, disease the heart, disease the intestines, disease the skin. That is anatomical pathology. Then we have chemical pathology, which is disease, of course, abnormal biochemistry, whereby you look at those smallest molecules in disease and and how to investigate them. Microbiology is a branch of pathology. Hematopathology, heme from the word haima, blood, from Greek word haima. Hematopathology, where we look at all diagnosis, this is why we look at, study all the blood diseases, from the bone marrow to the lymphoid tissues to other organs that are involved. This is the hematopathology. This is why we look at the sickle cell disease, we look at the blood cancers, like leukemias, like that, and then also other blood disorders like anemias, hereditary spherocytosis, like that. All those things are covered in the branch of pathology called hematopathology. For example, if I finish maybe my M.Med in pathology, you never know, I might pick interest and I go for a fellowship in hematopathology. You see? Then we have molecular pathology. Molecular pathology, this is where we look at specialized investigations. This discipline is actually still developing their molecular diagnostics, like fish, fluorescence in situ hybridization, recombinant DNA technologies, all those things. Doing DNA things where we look at DNA, where we do karyotyping, what. That is also much as it is part of genetics, but it also follows in molecular pathology. Polymerase chain reaction, what. All those tests fall under molecular pathology, PCR, what. Then we have what we call immunopathology. This is why we look at diseases that are caused by the immune system, or the diseases that affect the immune system. Whether there's immunodeficiency, or whether there is the excessive action of the immune system, excessive reaction of the immune system. Either way, when there's a weak immune system, when there's immunodeficiency, little immune system, weak immune system, there will be diseases. Then when the immune system is overreacting, even to the extent of attacking self and damaging damaging self, it translates into immunopathology. Then like AIDS is an immunodeficiency syndrome. Therefore, we expect disease to happen there. So that is immunopathology. Then also genetic disorders that also induce, cause immunodeficiency diseases, like that. Drugs that cause immunodeficiencies, like chronic corticosteroid therapy, high doses, will cause immunopathology also. So all this is also another branch of pathology. Then we have forensic pathology. This is where we do the postmortems or the autopsies from. You see? But the whole world only looks at this. Hey, you are the people who do cut the dead bodies and do autopsies or postmortems. Oh my God. Pathology, from then you have genetics. Genetics, this is what we do before you marry, before you get married and you commit yourselves. It is paramount, dear brothers and sisters, to always first go for genetic counseling. You screen for common diseases like albinism, you go for sickle cell disease. Those ones that can, yes, those diseases that will cause disharmony amongst the couples. There are so many other genetic diseases that we need to be going for. Why we should be on such basis, we should be going for screening before actually producing children. For example, if both of you are carriers and you happen to marry each other, you are going to start producing sickles. Now